Did you know that bladder cancer, although being one of the most lethal cancers, is 100% curable if detected and treated early? I am Dr. Tushar Aditya Narain and I'm a senior consultant in Uro Oncology and robotic surgery at Max Smart Super Speciality Hospital, Saket. And today we will be discussing in brief about bladder cancers. Bladder cancer generally affects males and females after the age of 50 years, and smoking constitutes one of the major risk factors. Most of the patients present to us with blood in urine, which is scientifically known as hematuria. Some patients can also present with frequency of urination and some pain during passing urine. The initial diagnosis is done with the help of an ultrasound scan, which is a simple scan which can be done in an outpatient basis, and the ultrasound shows us a growth or a tumor in the bladder. We also get a CT scan done to exactly characterize the tumor, the size and the location of the tumor in the bladder. And the initial treatment constitutes an endourological procedure called as transurethral resection of the bladder tumor, in which we put in a scope through the natural passage, the urethra, and visualize the tumor and take out the whole of the tumor. This serves two purposes. This takes out the whole of the tumor. It is also curative, and it also gives us the tissue for sampling, and which is later processed in the histopathology lab, and we get the exact nature of the tumor. Depending on the histopathology report, further treatment is decided. If it's an early stage tumor, we do not need to go in for any radical surgery. We can just put in some intravesical therapy to prevent the tumor from coming back, and we are able to preserve the bladder. But if the tumor is in a little advanced stage, it's muscle invasive, then a more radical surgery is required, which involves removal of the whole bladder. This surgery at Max we do with the help of a robot, in which we do not make any big cuts. We just make 6 small holes through which the instruments go in, and we take out the whole bladder and the fat surrounding it. Once the bladder is out, we reconstitute the urinary pathway with the help of intestines, which can either be a bladder inside the body called as neobladder, or a conduit, which is an ileal conduit. All of this surgery is done with the help of the robot, and the patients generally go home by 5 to 6 days after the surgery. After the surgery, most of the patients do not require any further treatment, but if the final histopathology reveals a further advanced tumor, the patients might require some chemotherapy and radiotherapy. If the tumor, as I said, is detected at an early stage, surgery is 100% curative and the patient can completely be cured of bladder cancer. For further information on bladder cancer and the treatment with the help of robotic surgery, feel free to contact us and get in touch with us. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.